CHT exam questions. Dialyzer are processed before each use to rinse out manufacturing residues and to establish the original fiber bundle volume of the dialyzer and check for leaks. Negative pressure is pressure created when fluid is pulled through a restriction. Dialyzer performance can be affected by reuse. Which of the following sets of potential problems may be related to reuse? Blood leak, first-use syndrome, inconsistent ultrafiltration. Dialysate conductivity measures. The total electrical charge of a solution. Dialysate that has too little sodium can cause low blood pressure, cramping, and bursting of red blood cells. Which of the following will increase the amount of solutes that will diffuse across the semi-permeable membrane? High concentration gradients. Normal body temp taken orally is 98.6. The normal range for resting pulse rate in an adult is 60 to 100 beats/min. Diffusion is movement of particles from an area of higher concentration. Dialysate that has too much calcium can cause irregular heartbeat, severe muscle weakness, vomiting, confusion. Which of the following is the first symptom that a patient developing dialysis disequilibrium syndrome is most likely to exhibit? Headache. The endocrine functions of the kidney include making erythropoietin and the active form of vitamine D. Why do kidney patients often have bone disease? Kidneys stop producing calcium. A rapid pulse of 104 beats/min would indicate that the patient has tachycardia. First-use syndrome is a hypersensitivity reaction to a dialyzer. It is characterized by back pain, anxiety, tachycardia, wheezing, circulatory collapse. Seizures during dialysis may be caused by all of the following except sudden decrease in dialyzer clearance. The components of the dialysis treatment that affect clearance include dialysate flow, time of treatment, dialyzer size, blood flow rate. Things that can affect dialysis adequacy include all of the following except Luo-Lock connectors. The leading cause of end-stage renal disease for adults in the USA. Diabetes. If there is a decrease in the patient or KT/V, which of the following factors should be looked at? 1. Increased access recirculation. 2. Diminished dialyzer performance due to reprocessing. 3. Inadequate anticoagulation of the blood. 4. Blood pump speed. Which of the following is not a symptom of chemical reaction due to incomplete rinsing of the germicide from a reprocessed dialyzer? Numbness in the access arm. 2 things that affect the dialyzer's ability to remove wastes from the body include surface area and molecular weight cutoff. A nephron is made up of a glomerulus and a tubule. Patients with kidney failure often complain of itching, which is likely to be caused by hyperphosphatemia. At which point in the extracorporeal circuit is the blood usually under negative pressure? The arterial line section before the blood plump. AAMI standards recommended quality control activites before a reprocessed dialyzer is used on a patient. How many people must check the dialyzer to verify quality control info? 2 people, one of whom should be the patient. Dialysate is the fluid that helps remove waste products from the body. It contains a number of substances: bicarbonate, sodium, potassium. A patient who is fluid overload will probably have which of the following sets of symptoms? Symptoms may be mild or severe: tachycardia, hypertension, dyspnea. Which of the following situations will cause an increase in venous pressure during dialysis? Venous needle infiltration. The transmembrane pressure has been gradually changing during the last 1.5 hours of dialysis. You suspect clotting in the dialyzer. The first action you should take is to rinse the dialyzer with normal saline. Dialysate that has too little calcium can cause numbness, seizures, and muscle pain. A semi-permeable membrane is a porous barrier that allows for only certain sized particles to cross. Symptoms that a patient may need more dialysis time include anorexia, fatigue, swelling. During dialysis, ultrafiltration occurs when water is removed from blood because there is a pressure gradient between blood and dialysate. The functional unit of the kidney or the structure in the kidney that does the work is the nephron. The instrument used for measuring blood pressure is called the sphygmomanometer. What is the most important SAF to monitor during a dialysis treatment? The dialysis technician. Dialysate that has too much sodium may cause patient injury. Too much sodium or hypernatremia can cause headache, high blood pressure, and shriveling of red blood cells.